I'm really looking forward to talking to the First Lady about maternal health and infant health, particularly as it applies to education, because the most important time in a child's developmental ability to learn is well before pre-K. It's prenatal to 3. If that mother is not getting nutrition and health care, that child is not going to have a good opportunity to get a good education. We have great schools in New Jersey, some of the best in the country, but we also have the biggest gap between the best performing schools and the least performing schools. And the way to close that gap is to make sure that that expectant mothers get the proper nutrition, get the proper health care, and the infant child as well before they even get into school.
No,
so let's talk about one of your most important causes for sure, and that's maternal health and infant health. Because we certainly have a serious problem here in New Jersey with high rate of maternal deaths and infant mortality as well. So what do you think we should be doing, and what are you doing about making that number go down? Because I know you are.
Sure. So I'd say back in about a year ago, the very beginning when Phil took office, we learned that that New Jersey is ranked 45th out of 50 in the United States of America in terms of infant and maternal health.
And we're the second wealthiest state in the nation.
Correct, with an incredible healthcare, innovative economy, and there's just no reason. Right. So Phil asked me if I could look at that for him. Being a mother of 4, it was something that's right up my alley. So I thought, I have to say, I went in with a bias, assuming that I was going to find that it was all to do with prenatal care, and that if we could get these women to...
I think that's why I have that bias as well.
Okay.
Yes.
So...
but it's not just that.
It's not. So it started off that we had just 2 departments who I was working with within the cabinet, Department of Health, of course, and it's now 12 cabinet members who are involved in this. And that is because it is literally everything. It includes transportation, it's insurance, it's access to food, so agriculture's involved. So we've got DOBI, we've got agriculture, we've got transportation, we've got the treasurer, Liz Moyo is involved. Of course, we've got Division of Children and Families, we have Human Services. It's such a complicated problem that can most easily be defined as systemic racism, because the numbers are bad, but they're really terrible if you drill down and see the differences between primarily black moms and black babies versus white moms and white babies. So essentially what we've found is that there are some big items that can be changed quickly. So we can reduce the number of C-sections that are being.
How do you do that?
You just set up protocols. A lot of this, as I said, it's systemic racism, it's unintended bias, it's doctors whose schedules can be more easily handled because they can set up C-section after C-section. Wow. But then what you also find is for a lot of women who have these C-sections, they don't have access for after they've had this child. So they will go home, and that's a major operation, having a C-section. So if you don't go back and have your checkups, or you don't have access to transportation, or you don't have access to childcare to help with your other children, there's a lot of reasons why people might not follow through. So reducing the number of C-sections that are not necessary.
That would not have come to mind.
Oh.
How did you come about that, finding this out?
I have spent the last year wandering around the state, meeting with all sorts of stakeholders, whether they are health systems, whether they are foundations, doulas, home health care workers, coalitions, nonprofits, everything. And there's a number of things, everybody would agree that there are too many C-sections.
So you're going to obviously change some regulations in terms of doctors and hospitals.
So Sharif El-Nahal, the commissioner at the Department of Health, he is currently trying to come up with some of those protocols for hospitals, and there's an overwhelming desire to fix this, because apparently 50 to 60% of the issues that kill these women and children we can fix. I mean, if it's easy enough to say, okay, you aren't going to be able to do the C-section. Another easy one, these are just kind of some of the things that we can do. Another one is that for a lot of women, most of the deaths for the mothers happen within like the first 45 days of that child's life. So let me just go back and tell you, so you know this. If you are a black child born in the state of New Jersey right now, your chances of living, or your chances of dying in the first 365 days of your life are 3 times greater than a white child. If you are a black mother giving birth in the state of New Jersey, your chance of dying in the first 365 days of that child's life are 5 times greater than that of a white woman. So another piece of this puzzle is, just to give you an example, is there need to be protocols in the hospitals. So if a woman comes and presents at a hospital and says, I have a headache, or I have had the chills, or this could be an underlying problem that's related to having given birth. So doesn't it seem like one of the first questions anybody should ask in the emergency room is, did you deliver a baby in the last 45 days?
If they get around to asking a question after they're waiting in the waiting room for an hour, right?
Right, but it can be easily, it could be one of the first questions is asked. If you find out the answer is yes, that puts you in a totally different category. But if you don't have to ask the question.
And they have triage systems, so that should be part of the top of the system, right?
So there's little fixes like that. There's things that can happen. We also, I think one of the biggest challenges here in New Jersey, probably across our country, if not the world, is that good people are working on these problems, but they're in their own silo.
Yes.
And so, everywhere I went, someone would have a great solution to working with mothers who have been living on the streets, or who are addicted to some kind of opioid, for example. They might know how to deal with those people, but someone who's in the health system in a different county is still trying to come to grips with how they can best handle that problem. So one of my greatest assets and my biggest value that I bring, I think, for New Jersey is that I can convene people. I can put people together and make them talk to one another. So over the course of the year, I've done that. We had an infant and maternal mortality summit at Drumthwacket, and we brought together all the different commissioners. We brought together these foundations, and instead of putting all the foundations at one table and all of the commissioners at another table, every single table had a mix of different types of people. And then what I did is I gave each table questions that pertain to a particular cabinet official who was at that table.
And this will be an ongoing process.
We're going to do it every year. We're going to do it every year. So we did it already, but it was really fascinating because the foundation could hear directly from a doctor